Hello there, this is Pawan and I'm a registered nurse working in one of the hospitals in Sydney, and in this video I'm going to talk about nursing in Australia. So if you're thinking about getting yourself enrolled in nursing degree here or just want to have a general overview of how we go about nursing in Australia, stay tuned. So guys, I came to Australia in 2015 as an international student to study Bachelor of Nursing degree here in Sydney, and I graduated at the end of 2017 and have been working as a registered nurse ever since. And I'm making this video for all of you out there who are considering nursing as a career option in Australia. So basically I'm going to talk about what different types of nurses we have in Australia and what are the requirements for you to get in, how much does it cost, and my final verdict at the end if it's actually worth it. So let's find out. Okay, so let's first talk about different types of nurses in Australia. So basically there are two different types of nurses when you first start. There are enrolled nurses and there are registered nurses. Enrolled nurses have completed a Diploma of Nursing, which is a 1.5-year course done at either TAFE or private institutions. On the other hand, registered nurses are the nurses who've completed a 3-year degree, Bachelor of Nursing degree at university level. In both cases, during the course of study, there is a workplace-based component where you are sent as a student to different hospital settings, mental health facilities, and aged care settings to gain some experience as a student. So basically, enrolled nurses are the nurses who work under the direct supervision of registered nurses. They can't act independently. On the other hand, registered nurses have more responsibilities because they've done a 3-year degree course instead of a 1.5-year degree course. Okay, so let's now talk about what are the requirements for you as an international student to get into nursing in Australia. So basically, you need to have passed your Year 12 examinations, completed your senior secondary education, if you are getting enrolled into nursing as an undergraduate in Australia. Another very important requirement for you as an international student to get into nursing in Australia is that you should be able to speak and write English really well, which is very fair. So basically how they test that is you need to sit an English exam, IELTS. So the requirement says you need 7 bands in IELTS for you to be able to register it with our program. But there are two things to remember when it comes to these IELTS scores. A, you don't actually have to sit IELTS. You can sit other examinations called OET, which is Occupational English Test, or you can sit the PTE, Pearson Test of English, which is relatively easier. Many students find it relatively easier than IELTS. Another thing that you need to remember when it comes to English test is that yes, you do need 7 each at the end of your degree to get registered with APRA, but you don't actually need 7 each to start your study, because many universities in Australia actually let international students enroll in the course of study without having 7 each, which means maybe some universities will allow you to study at 6 in one of the components of the test. So yes, if you are able to get 7 each in all the components of the test, great. But if you can't, don't worry about it. Just do your research before you apply to any university. So where in Australia can you study? Well, nursing is a very popular course. So many universities across Australia provide this course to both domestic and international students. But there are a few things you need to consider as an international student before you enroll yourself into nursing in Australia. Well, first things first, surely the big cities like Melbourne and Sydney are very eye-catching to international students for obvious reasons. But if you get enrolled into a university in, let's say, Sydney or Melbourne, it's very expensive to live as an international student in these cities when you don't have any support system. However, there are certainly more job opportunities in these cities for students to work in. I'm not talking about the jobs you will be working in as nurses when you graduate. I'm talking about the jobs you will be working at as students. So certainly there are more job opportunities here in the big cities. But it all depends on the individual circumstances you are in. So let's say if you have a lot of money to spend, then may as well go for the big cities and enjoy the life there. Another very crucial point for you to consider is that if you get yourself enrolled into one of the universities in Australia which falls under a regional area, that means you will be getting 5 extra points towards your permanent residency application when you apply for it at the end. So keep all these points in mind when you do your research to which university you're going to be applying to study in Australia. So how much does it actually cost to be a nurse in Australia? Well, it depends. Depends on which course you're going for. If you're going for Diploma of Nursing, which is only a 1.5-year course, It costs about $8,000 per semester, and a semester is usually for 6 months, so it would account for $24,000 for the whole course. Whereas if you go for Bachelor of Nursing degree, it is a 3-year degree full-time, and it costs about $13,000 per semester, and it counts for $78,000 in the end. But it depends which uni you go for, because different unis have different tuition fees. So do your research before you apply. Another very common thing that people do these days is that they do the Diploma of Nursing first, and while they're working as an enrolled nurse, they progress towards their registered nursing degree, which is a good thing to do because A, it's quicker, B, it's cheaper, and while you're working as an enrolled nurse, you can part-time or full-time study to be a registered nurse. So now comes the million-dollar question. Well, not a million-dollar question, just a $78,000 question. Is it actually worth it? Well, based on my experience, if you are genuinely interested and you see yourself working in a healthcare facility, I would say definitely consider it. Nursing is a great profession. It's very well respected. And not to mention, you do get paid a decent amount of money if you work as a nurse in Australia, and you would never go out of jobs. Nurses are always high in demand. Now, coming from an immigration point of view, nursing has always been in high demand in Australia and is still on the skilled occupational list, which means you can eventually progress towards your permanent residency if you want to live in Australia for good. And at last, Australia is a great country to live in. It has good work-life balance, has great healthcare for all its citizens. I hope you found this video useful, and if you have any questions, please drop them in the comment box below. And if you would like me to create more videos like this, please subscribe to my channel, and I will see you in the next video.